Sure. Hey, Camille.
So welcome to the Mailman Center Grand Rounds for December for this quarter. And it's our lifespan IPC is proud to host Mr. Brian Russell, who's the Emergency Management Coordinator with Disability Rights Florida, where he works to ensure that the needs of persons with disabilities and their caregivers are included in emergency preparedness and response and recovery efforts across the state of Florida. Prior to this role, Brian was the program manager for the Department of Health's Disability and Health Program, where he focused on adapting and implementing public health interventions for persons with disabilities. During emergencies and disasters, Mr. Russell serves as the state access coordinator also with the Florida State Emergency Response Team, providing guidance and recommendations to ensure that the needs of persons with access and functional needs are met during all phases of disasters. So we're very pleased that he's able to address us today on the topic of improving access to care for Floridians with disabilities. Mr. Russell, thank you very much, and take it away.
Thank you. All right, does that work? Do y'all see a purple picture?
Yes, we do.
Awesome, good deal. So thank you. And so I'm going to kind of talk about healthcare access, a little bit of, I'm going to throw in some disability competency, and probably, and if I lean a little heavy on access to things like COVID and access like vaccines and maybe some emergency preparedness stuff. Forgive me, but I live in the emergency management world right now. So kind of just going to kind of talk about, we're social determinants of health, disability, and chronic disease and healthcare access all kind of meet, and how we can navigate that better. I'm going to try. How about that? There we go. So, it's kind of what I want to talk about. So here's some of the acronyms I'm going to use. If you hear me say things like BRFSS, it's going to mean Behavioral Risk Factor Surveillance System. CILS are Centers for Independent Living, the ADA. PWD is Persons with Disabilities. PWOD is Persons Without Disabilities. And, a lot of kind of access is going to depend on how we define disability. This is an ongoing conversation. I remember me and my colleagues, when I was working with the Department of Health, me and my colleagues from across the country, we would have these discussions quite often on what is a disability, on how do we define disability. For some people, it's how they've grown up. It's, I don't have a disability. It's just who I am. But the government says I have a disability. So how do we define that? Also is going to depend on things like what the dictionary calls it, a physical or mental condition that limits someone's movements, senses, or activities. The BRFSS for data collection purposes, kind of defines it a little differently. The census, for obvious data collection purposes, defines it a little bit more in line with the BRFSS now than how they used to. And the ADA has another definition. The ADA, takes into account definite, the limitations of a disability of major activities, but it also includes if you have a record of having an impairment, or if you're thought to have an impairment. So it's definitely a work in progress, so to speak. One of the things that, I can't really use this word in some state agencies anymore, equity. I can, because I no longer work for the state government, but some of my colleagues at Department of Health can no longer, they're really scared of the word equity. I'm not, and I continue to use it. But health equity is where every is when everyone has the opportunity to be as healthy as possible. It's kind of like this scenario with the bicycle. Equality is when everybody gets the same bicycle, but everybody doesn't need the same bicycle. Equity is when everybody gets the bicycle that suits their needs. They're not promised to get where they're going, but they're promised to have what they need to get where they're going. Currently, disability in Florida looks like this. About 26% of all Floridians have a disability. About 12% have some type of mobility limitation, and another 12% have what's considered a cognitive or intellectual or developmental disability. These are some not so great stats as well, especially the state ranks 34th according to the UCP in providing disability services. That's not great, especially when you consider our lack of access to healthcare, whether it's through the fact that we still have a waiting list for people with disabilities, with certain disabilities to access services. When I hear that the governor wants to set aside $1 million to sue a college football playoff committee, but he doesn't want to use that $1 million to help people with disabilities have better access to healthcare, or homeless people or homeless veterans. No, we're going to sue somebody because my football team didn't make it in a playoff. That's a little petty, just a little petty. But so yeah, so and I just kind of wanted to share these are just some statistics on what public health, on what disease, chronic disease and disability looks like. And just trying to highlight the lack of, the high prevalence of, people with disabilities have higher rates of obesity, depression, heart disease, diabetes, anxiety, high blood pressure, a lack of physical activity, and a lack of access to health insurance. Even today, about 28% of people with disabilities do not have health insurance. And about 43% of adults with disabilities are physically inactive. And that can speak directly to a lack of access to whether it's a lack of access to things like parks and recreation opportunities. It could be a lack of transportation, don't feel safe going to the park, don't have access to a public health chronic disease program, don't have access to their doctor. So they can't see their doctor because they can't get a ride or they can't afford it. And this is another part where that we've seen a direct correlation with a lack of access to healthcare. Things like they don't have transportation to the doctor. They 15% reported that their physician that their physician was not attentive to their needs. Their physician has a lack of understanding of their disability. Or they don't understand what their health issues are. And people with disabilities tend to have a lot higher stress. And we're seeing this especially now, 4 times more likely to have to deal with food access to food. And that's just food. That's not healthy food. Healthy food's even more. So here, and so what can we do about it? I think removing the barriers is definitely something. Whether it's physical barriers, improving the physical access, or physical access to the facilities, to the offices, to wherever you're going to be. and I kind of want to camp out a little bit on the second part about the inequitable distribution and the raising awareness. Um, most places are physically accessible thanks to the ADA, but the ADA also requires programmatic accessibility. So, if you have patients or clients that can physically get to the office, but cannot hear, cannot visualize, or cannot understand the instructions, it's not really going to do any good. If you have someone coming to a vaccine clinic to get vaccinated for COVID or flu, and they can physically get there, but if they're deaf or hard of hearing and if they need an ASL interpreter, but you're not providing that, then it's kind of pointless. So you may want to make sure that you have everything to make it accessible. This is also, you want to make sure that you have appropriate healthcare for people with disabilities. That also leads to, more employment opportunities. You want to make sure that you include people with disabilities in all of your public health data collection efforts. Things like, for instance, I was on a conference call with FEMA recently, and I just happened to ask the question about, how are you, what does it look like? I asked the question was mainly more about people with disabilities directly impacted by Hurricane Idalia, and the presenter had no clue. They didn't even answer. They didn't even address that. They were talking about other demographic indicators: race, ethnicity, gender, age, poverty level, but not disability level. Or including disability as one of those key indicators. And also making sure that you include disability self-advocates on your local coalitions, advisory boards, and definitely just expanding your training opportunities for healthcare professionals. Continuing to build those bridges with your physicians and physician assistants and nurses and nurse practitioners, on here's how to work with people with disabilities, kind of like basic disability competency. And these are just some of the different resources that we use, and some of the resources we've gotten data from. And these were some final thoughts, but relating to mainly access, some of the other things that we've seen probably within the last year related to healthcare access, or lack of access. One of the big things we've seen is once when COVID first started, and when COVID vaccines were first available, making sure that the disability community were on the list, had access to vaccines. We had vaccine clinics popping up. We had pop-up vaccine clinics. The cost was free. The distribution was, relatively speaking, was pretty good. The distribution plan was good. It was well thought out. We wanted to make sure that people in the community got vaccinated, had access to vaccines, and they were. Once in Florida, once the governor ended the state of emergency, and then when the federal government ended the national state of emergency, the distribution plan really kind of took a nosedive from our perspective. We continued getting calls in our office from people who, for lack of a better phrase, were homebound. I haven't found a good word to replace homebound, so forgive me. but they were unable to leave their home for medical or disability reasons, and which meant they could not access vaccines. And we're continuing to get phone calls. And once these about this access issue, and yeah, and so that's one of the areas where we're still seeing a lack of access. Is the minute is once the state of emergency was lifted, out of the 67 counties in Florida, probably 64, 65 of the county health departments said, no more in-home vaccines. We're not going to do home, in-home delivery of COVID vaccines, or of any vaccine for that matter. So that closed that access for thousands of people with disabilities across the state. So there's still a lack of that. So there are still barriers that we're trying to find workarounds for. We're trying to find ways to get over those barriers with that. Access to healthcare access even after Hurricane Ian are still not just healthcare, but access to basic services after Hurricane Ian were still definitely impaired based on disability. We saw a lot of issues, and we still have some issues from clients dealing with the after effects of that as well. But I mean, the bottom line is, you want to continue to plan with the disability community, not planning for the community. And I realize I'm preaching to the choir on that. I know that was a little short and sweet, but questions, thoughts?